There we go. And it is 2 o'clock. We only have half an hour, so we're going to go ahead and get started. And we are so grateful for everybody who has joined us and for those who will be joining us over the next few minutes, I'm sure. We are here today to talk about restarting and energizing patient and family advisory councils with easy to implement how-to lists. And today we're focusing on the topic of recruiting patients for your patient and family advisory council. We wanted to cover several aspects of this: the definitions of recruitment, qualities of who to recruit, how to find persons to recruit, how to reach out to recruit persons, a timeline for your recruitment strategy, including when to recruit for new and existing PFACs. These are all topics that we are asked questions about all the time, but we're only going to scratch the surface today. We want you to be thinking in terms of what other questions you have and how we might be able to serve you further with some of the options that we have that we'll be discussing. Let's talk about what is recruitment. Boy, you know, recruitment is something that you will be doing if you have a PFAC, and it is the process of actively seeking out, finding, and hiring candidates for a specific position or job. Now, you may not think of it in terms of hiring, but really that's what you're doing. It's very similar to the HR process of finding people. It's actually the number one question that we get asked all the time by healthcare people is, where do you find patients? Which, if you think about it, could be a little bit on the absurd side, since in healthcare, patients are what we're all about, right? Where do you find patients? Well, they're in your beds, they're at your clinics, but it's really being asked in a way that indicates there's more to it than that. And what we want to do today is address that more too. Address the process of adding new individuals to a population or subpopulation, in this case, your patient and family advisory council. Let's see if I can get this to advance. There we go. The first thing we want to talk about is what are the qualities. And of course, the first most important thing for a patient and family advisory council is that you have somebody who has patient experience as a patient or a caregiver. And those people should have that experience at your facility so they can address specific issues for your facility. And that may be a hospital, it may be an ambulatory clinic, it may be a residential facility, but they need to have experience dealing with your specific environment. Now I'm going to hand it off to my great colleague, Armando Nahum from the Healthcare Patient Partnership Institute, to talk about the rest of those qualities. Armando?
Yeah, thank you very much, Lisa. So let's cover these other topics right here. When we talk about qualities on who you recruit, the patient or the caregiver really has to be able to see beyond their personal experience, right? They have to be able to offer their views on how to make the healthcare better. It's not about their story per se, although we tend to be, mindful in the very beginning to listen to their story, and that comes through their interview primarily, but also at maybe the first meeting. Some PFACs will have storytelling in the first meeting, second meeting, but beyond that, it's you have to think of recruiting patients or caregivers that think beyond their personal stories. They have to be able to collaborate. They have to be able to work in a group environment. This is not their own agenda. They have to also be non-judgmental. So you want to make sure that you look for people that don't have I call them, they're the ones that constantly complains. No, definitely you don't want those. And they have to be able to learn and adapt to the organization needs as well. And then you want to get representative of the population that you serve. It's really, really important so that you would have diversity in the council that you're building. Next slide. So where do we find them? Well, people ask me this question all the time. You know, they say, how do I find an Armando? And I think they give me a lot more credit than I deserve. I really don't deserve that much, but I tend to push them to one area that it's really close to my heart, and that's the grievance database. Every institution, every hospital has a grievance database. And so why do I push for that? Because those are the people that have experienced harm or have lost a loved one under their care. And so it's important to wait maybe 1 year, 2 years after their grieving period, and then bring him in for a conversation. You have to start with a conversation. 99.9% of the time, we find out that if you look at the grievance database and you search for those people, they are more than willing to help. They want to be a part of the organization. Why? Because they live in your community and they want your hospital to be the best it can be. The second box that you see there at the top middle is referral from your clinics and departments. That's another great way to recruit, is to go right to your, the nurses in the various unit floors of the hospital, the doctors in ambulatory settings, your own doctor physician office. Those are the places that are able to, they know their patients, they can make recommendation.
And Armando, something
Yes.
about that I have found particularly helpful is we are used to, in the medical world, asking for referrals. So if I need to see a provider and you know a good one, you will give a referral, and they'll even send a letter back to the doctor who made the referral. Thank you for referring this patient to me. And that's all well and good. But if you think about it, not just in terms of a referral, but also think about it in terms of going to your clinics and your departments and saying, boy, we'd really like to see oncology or maybe transplant or rehab in this hospital represented on our Patient and Family Advisory Council. And who can you think of as a patient or family member who could represent your group? They are much more likely to get you a name than if you just ask for a referral, because then they feel like you care about them and they will be heard. Their needs, their patient population needs will be heard on that council. So think in terms of representation as well as a referral. And you can also go to your current Patient and Family Advisory Council and ask them for who they know. Especially, I found they tend to, for example, if you have been a patient in oncology, you know a lot of the other patients. If you have been a patient in transplant, you know a lot of the other patients and family members, and you may know of somebody who would be just really great for the advisory council. So if you have a current acting council, be sure to ask them for who they think would be good on the council as well. Another thing Armando and I have talked a lot about is the importance of representation between the board and the PFAC. So having a board member on your PFAC, having a PFAC member on your board, the point is that the PFAC member, if they are on your board, needs to stay a member of the patient and family community of the hospital, not be a representative from the community at large, and have a reporting system where information from both groups can go back and forth as appropriate. That's something that you'll want to have your probably C-suite people involved in, right, Armando? Because you want that information to be vetted before it goes both directions. You don't necessarily want all of the board information shared in the PFAC, but have that representation. It will make a difference for your facility. And finally, you can reach out to community organizations for persons they're aware of who were served by your facility and may be good representatives from their organization to your PFAC as well.
Yeah, Lisa, if I can just quickly add something about board members.
Yeah.
You find that a lot of organizations will say that, well, we can't have a patient on our as a board member, although that's not really true, but they'll say that sometimes. And so that's when I turn around and say, okay, then how about you become a member of the PFAC? And that always works extremely well, because if you build your PFAC, especially if you build it under the quality and safety department, so that it reports to quality and safety will report to the board. And so now you have a bilateral reporting structure that works extremely well. And the board is always, it always gets to know what the PFAC is doing.
Boy, that's an excellent point, Armando. And I'd like to point out that the first Intermountain person who served on a hospital board was from the PFAC that I managed at the Children's Hospital. And the person that we had fulfill that position, when she was interviewed by the chief executive officer of the hospital, said, you know, you probably should be aware I have not even graduated high school. And he said, is that supposed to be a problem? Because I don't see it as a problem.
Right.
And this is a person who had served on the medication or the Medicaid advisory committee and was very active in outreach to the children's hospital chronic complex population. She's perfect. She's perfect. She's smart. She's capable. So we need to look beyond those credentials sometimes to find people who will really be able to work both on a board and the advisory council. So one of the things that we have need of is a call to action. You need to reach out to people and say, you know, we need you. We want you. You are going to provide a service that is invaluable to us. And there's a number of different ways you can go about doing that to find people and help them feel motivated to respond to you. Armando, one of the things that H2PI recommends is sending out letters to your database.
Yeah, that's, excuse me. Yeah, that's certainly one way to do it. Although, you know, sending letters is expensive. From a marketing point of view, if you get 1% back, you're doing very well. So a lot of times organizations say, well, we don't want to, you know, go through that expense. And there are so many other ways to recruit, right? You got social media. Everyone has Facebook and nowadays Instagram as well. Again, ask for referrals. We've even produced PSA for TV and radio. A quick 30-second. We just did a hospital during right after the pandemic broke out, the University of New Mexico, who utilized their TV connection and radio connections with a PSA, and it worked extremely well. Flyers in your community centers. You know, reach out to your local community centers and put out flyers. I always like to see a signage at the facility that is embarking on the PFAC at the front entrance by the elevators and high traffic areas that that puts out signs to ask people very brief description about the PFAC and a number to sign up. And even put a QR code there. Everybody is familiar with QR codes and that signage, so they can just point out their smartphones and they actually get to that web page. Flyers in ambulatory offices, you know, that are associated with the facility. Certainly that works very well. And then, you know, even print ads, again, with QR code. We did a QR code with a video on recruiting for MedStar Health, which is the largest system in the Mid-Atlantic covering Washington and Maryland, and we put them on the buses. And we were getting people right and left because they would point their phone and they would get a little video that talked about the building the PFAC. So it was really, really fantastic. There's so many different ways, and people get very, very creative.
You know, Armando,
yes.
One of the things that was brought up to me is the importance of keeping information about what your patient and family advisory council is doing in social media, and let people know that you have one, maybe by putting pictures of current members up in your lobby or some other high traffic area, because that also shows that you have an advisory council, lets people know a little bit about what they do, and then they can have that. And, you know, something we didn't include here that just occurred to me, I should have thought of it earlier, was, for heaven's sakes, have it on your webpage that you are recruiting on an ongoing basis and what the advisory council does.
Yeah, let me point something else out, Lisa, that the recruiting process on any PFAC, whether you have an old PFAC, you're just building one, it's a constant thing. You'd never stop recruiting. And we'll go into this in the next few slides in more detail.
Absolutely. I want to point out that Janice Tufte has given us some good pointer, and that is that if you are putting together PSAs, consider placing them on your ethnic media stations and outlets so that you can reach out to that diverse patient population as well.
Yeah. So you can ask to be interviewed too. So, you know, a short interview with them. Yeah.
Good point, Janice. Thank you.
Yeah.
Okay.
Okay. So at H2PI, the Healthcare and Patient Partnership Institute, what we've done is we built this particular timeline. You notice that we call our PFAC, we put a QNS because we really prefer PFAC, organization established PFAC on quality and safety versus just patient experience. We really stress that quality and safety portion. But we used to, prior to COVID, we used to go 3 times in person to the organization that would ask us to consult with them. And that's where you see the stars. And then, of course, when COVID broke out, we stopped, traveling. And so we still use this timeline because it gives you an indication of the 3 phases, from assessing and planning to building, and then the action, the final, which is the action phase. It takes about 6 to 9 months to build a proper PFAC. And I've seen hospitals do it in 3 months. That's the fastest I've seen it done. But it's usually 6 to 9 months. Next slide. Back to you.
So we have when, and really people are looking right now for both new PFACs or starting PFACs when they haven't had one for a while, or on an ongoing basis. So let's first address a new PFAC. You first need to have and develop your solid recruitment strategy with a project team. And Armando can talk to you about what a project team consists of. That's part of their consulting operation, but you want to gather together people to do this, not just one person ideally. And then plan your integrated outreach across platforms based on what we've just talked about. So don't put all your eggs in one of those baskets. Try to use as many options as will work for you and how your community best handles these things. And that will vary from place to place and community to community. Different people have different media options. Different people have different protocols and cultures within their hospital. So let's talk about what works for you. And then keep your team members and potential members of your PFAC aware of what the progress is toward getting to the first meeting, because that's what's on everybody's mind. When you recruit the first person and you say, boy, we're really glad we're going to have you for our first meeting, they need to be kept aware as you go through the next few weeks and you're recruiting more people, because they won't all come at once, that you're working on it and you haven't forgotten about them and they're not just hanging out there somewhere, but you're going to get a first meeting at some point when you have a full complement of individuals for your team. So
Lisa, can I quickly add something here about the project
you
team?
bet.
Yeah, the project team should always consist, depending on the size of the organization, but it's usually between 6 and 10 people. Why do we say that? Is because it takes, you want to direct this whole entire process to various people. You don't want just one person to do it all. It's impossible. And it takes a little bit of administration to do this. So especially when it comes to then finalizing the potential members of the council, when you have to interview them, if you just have one person doing this whole thing, it's just a nightmare. So
Karen has a question. Do you want to just quickly tell us what that is, Karen?
Okay, thank you. Sorry, I was late getting in. I've got computer issues going on. Joy of joys. In your history, have you had any attorneys contact you for discoverability of the information that you are working on?
I have, Karen, actually, and that's an excellent question. Just FYI, your Patient and Family Advisory Council is not a public meeting, and it doesn't need to follow public meeting rules or anything like that. Your board, of course, is different. That is a public meeting, but this is not a governance. It's an advisory council. It would be like the right somebody would have to focus group information. They don't have a right to your focus group or marketing information. And that's basically what a Patient and Family Advisory Council offers to you. Is it's very similar to a focus group. I actually had to research this for our hospital when there was somebody who adamantly wanted the notes from our meeting. And that's another point, is that you don't really have minutes from meetings, you have notes, because it's not a formal public meeting. It's more of an advisory meeting with kind of like a focus group setting. And if you think of it in that and you explain it to the attorney in that way, they'll understand it's not a public meeting. So let's get into
actually,
Karen.
Lisa, those are very specific words that make a difference. I'm a member of ASHRM. Are you familiar with ASHRM?
Yeah.
And, so I come from that perspective as well. So I want to make sure we have as much protection as we can. And, what a difference a word makes.
Absolutely.
Yeah. And Karen, let me point something out. When we built the University of New Mexico Hospital, that was one of the very first questions that came to us, because University of New Mexico Hospital is a state-run hospital, and they automatically assumed that it was a public meeting. And so we had to make sure that they understood that it was not, as Lisa mentioned. And then it was smooth as it could be after that.
It's good. I work closely with the Joint Commission and the Joint Commission standards, and having patient and family engagement really delights them. So this is a really good move.
Yeah.
Okay, thanks, Karen. So Armando, do you want to take how we look at recruiting for PFACs that are already established but may want to get going again or need an ongoing rolling recruitment?
Sure. PFACs that, obviously COVID put a damper on the PFAC and meetings, and some of them have put them to the side and said, we don't have the time for that. Some of them were bombarded by constant phone calls by the PFAC members saying, why aren't we meeting? Because we want to help out any which way we can, especially during COVID. So they had to reconsider on how they would meet, and then they went on a virtual basis. Always, always, always have a strategy in mind. Need to consider terms of service.
So for example, if you
yeah.
have 2 years that they're serving, then you know that you've got a
Oh.
third rotating off each time, then you're going to need that third, but then you're also going to need room for attrition, right, Armando?
That's correct. Yeah, that is correct. Maybe be focused to a few months a year, maybe ongoing. Here's what I find, that hospitals that have a robust PFAC, they will meet every single month, except for maybe holidays, Thanksgiving, Christmas. But hospitals that don't do so well, that they don't have such a robust PFAC, they tend to meet like maybe every quarter. And I find that you lose out because the council members, especially from the community, are not engaged enough. And we'll get into that a little bit. I don't know if we have time, but we like to get these council members on committees, and that's how you grow your PFAC. You can't always have the same people, because what happens, as Lisa mentioned, you'll have them for a number of months, and then after that, if you don't constantly recruit, what do you do with them? So why lose somebody like a Lisa? Why lose somebody like an Armando that has been engaged, let's say, for this period of time at the council? Move them into committees and then make them ad hoc members. So you grow your PFAC constantly. And now all of a sudden you have 10 committees of patients and family members that are helping you on quality and safety, are helping you on hand hygiene compliance or CLABSI or sepsis. And it's really, really fantastic to see a PFAC grow that way.
Yeah, and I think we covered the last 2 points here. And I think Nadine has a question, and we are running out of our half hour. So I want to move ahead. Nadine, can you tell us what your question is?
Yes, it's just really quick. It was kind of what Armando just touched on, the hierarchy of a well-established committee like I've been on a few years, and I moved to an ambassador status. And what does that, deliver? Do you become a higher level involved, or do you subset to committees? The other thing is, I'm telling you, it's blows my mind. I've been on so many local and national PFACs, and people that are so knowledgeable in their own right hardly ever say anything, if anything.
Boy, Nadine, that is a good point. And that gets back to an earlier webinar that we had on meeting facilitation. You can find that on our YouTube page, as well as the PDF on the how-tos from that will be on our website, www.patientsafety.org. So I appreciate that you brought that up.
Thank you.
And if you want to get in touch with Armando and myself, this is our contact information. You will get that on the PDF that I will be sending to you right after this webinar. And Armando, do you want to talk about 2 minutes on the H2PI program journey that you have here?
Yeah, I'll take 1 minute. How's that? So because of COVID, we were forced to develop our entire strategy in a whole different way, obviously virtual. And so we came across a piece of software that is built on artificial intelligence that allows a project team to take the entire journey virtually. This is not Zoom. This is a collaboration among the project teams. This is totally customizable to the organization, with color scheme, marketing scheme of that particular organization. Your logo goes on the top left. And what we do is we take you through the journey, which is 35 different modules. What we are now doing, because we've had a lot of requests from different hospitals that say, hey, I already have a PFAC. I don't need to take the entire journey. So we're building what is called a mini journey, just to reinvigorate your PFAC. And it will have, obviously a lot less modules than this, but it's absolutely fantastic. You take it on your own time. your project team could be one person could be in their office, the other person could be at home, and you could take the journey. So I'd be more than glad to give you more information if you so want to. Just reach out to me and even give you a demo if you would like.
Boy, thanks so much, Armando. This is a really worthwhile opportunity, and it is an investment, but it is not a huge investment relative to not knowing the things you're going to learn if you have a working PFAC. And Armando and Marty Hatley have worked together very hard on this over the past several months to make it work for you under these circumstances. Appreciate your kind comment, Nancy. I saw that you appreciated the content, and I hope that you'll look to what we are going to do next month too, which is we're going to talk about the other people who will be attending your patient and family advisory council meetings, and that will be staff and providers. How do you find the right people from that group to come and represent their areas and in your facility? So that will be, oh, it says recruiting patients. I don't know why that didn't change. I thought I had updated that. But anyway, that'll be February 15th, same time, same station, and we'll send out information in the newsletter in a few days. And again, about a week prior, we'll send out information about how you can register. So we're really excited about kind of having the complement to that and moving forward with this group. Thank you so much for attending today. And thank you to everybody who has given me input to build these for you so that you can restart and re-energize your PFAC. Have a great day, you guys.
Thank you very much.
Lisa and Armando.
Thank you very much.
Thank you.